Which bone forms the ankle? Talus. It is formed by three main bones, the tibia, the fibula, and the talus. The bottom of the tibia and the fibula form a socket, into which the top of the talus bone fits, creating the hinged ankle joint that allows for up and down foot movement. Which muscle enables smiling? Zygomaticus. It lifts the corners of the mouth, creating expressions of happiness or amusement. Which condition is caused by excess uric acid? Gout. It forms sharp crystals in joints, triggering sudden pain, redness, and swelling. Which organ filters pathogens from lymph fluid? Lymph nodes. These small, bean-shaped tissues act as filters, trapping bacteria, viruses, and other foreign material before it can re-enter the bloodstream. Lymphocytes within the nodes then destroy these trapped pathogens. Which condition causes red, itchy skin? Eczema. It inflames the skin barrier, leading to irritation, dryness, and persistent itching. Which condition involves chronic airway obstruction? Asthma. It narrows airways, causing wheezing, shortness of breath, and recurrent coughing. Which condition causes yellow skin and eyes? Jaundice. It appears when bilirubin builds up due to liver or bile duct problems. Which disease involves chronic joint degeneration? Osteoarthritis. It gradually breaks down cartilage, causing pain, stiffness, and restricted motion. Which hormone raises blood sugar? Glucagon. It signals the liver to release stored glucose, preventing dangerously low blood sugar. Which organ removes worn red blood cells? Spleen. It filters aged cells from circulation, recycling components like iron for reuse. Which hormone stimulates milk production? Prolactin. It triggers mammary glands to produce milk after delivery, supporting breastfeeding. Which tissue forms blood vessels? Endothelium. It is a type of epithelial tissue that forms the inner lining of the vessels, along with connective tissue, smooth muscle cells, and a basal lamina, which is a supportive layer of extracellular matrix. Which organ stores fat-soluble vitamins? Liver, along with fatty tissues, stores fat-soluble vitamins in the body. The four fat-soluble vitamins are A, D, E, and K. Which condition involves loss of coordination? Ataxia. It is the primary neurological condition that causes clumsy movements, balance issues, and difficulty with walking, speech, and eye movements. Which nerve controls swallowing muscles? Glossopharyngeal. It coordinates throat muscles, allowing safe and efficient swallowing. Which nerve controls eye movement? Oculomotor. It moves the eye and lifts the eyelid, guiding vision and focus. Which hormone lowers blood sugar? Insulin. Produced by the pancreas, insulin acts like a key, allowing blood sugar, glucose, to enter the body's cells to be used for energy or stored in the liver and muscles. Which organ stores red blood cells? Spleen. It is the primary organ that stores red blood cells, acting as a reservoir for them in addition to filtering blood and removing old cells. Which nerve transmits smell information? Olfactory. It carries scent signals from the nose directly to the brain for interpretation. Which condition involves airway collapse during sleep? Sleep apnea. It occurs when the soft tissues in the upper airway relax too much during sleep, causing them to block the airway, which can lead to pauses in breathing. Which tissue lines internal organs? Epithelium. It forms protective layers inside organs, allowing absorption and selective transport. Which organ produces testosterone? Testes. It drives development of male characteristics and supports sperm production. Which hormone stimulates ovulation? Luteinizing. It triggers release of the egg from the ovary during the menstrual cycle. Which condition involves fluid in joints? Effusion. It accumulates from injury or inflammation, causing swelling and limited movement. Which organ regulates electrolyte balance? Kidney. It controls sodium, potassium, and water levels, keeping body chemistry stable.